because I know everybody's interested in that. Everything is creating one thing: stress, stress, stress. COVID is a stress. Kids are stress. Relationships are stress. Job is a stress. Everybody wants to talk about that. That's why I keep it at the end, because I know when you guys is going to get bored, then we can talk about that, and you will feel good. I wanted you should feel good. That's very important. That's my mission for today. That's my vision, that I want to be like you guys, feel like comfortable with that. What is stress is? This is like that's my favorite. I made by myself. I'm a creator. I love to create something. This is like I was just working on anxiety, and there was one of the lecture, and I realized that let's make it that way. Then people, it's easy for people to understand that. This is a thermometer. Just see, this is like from there it starts. When you have a little anxiety, little stress, it's okay. Why it's okay? It's okay because number one, if we have like assignment, if we will not have a little anxiety, then we will not do it. We will not take care of whoever is texting us. We don't care about that. If this assignment is going, we don't care about that. Then it's not good. A little anxiety is all the time to keep you on the track. If you have a little anxiety, normal anxiety, then take it easy. Don't go in like, oh my God, I have anxiety. That's the first level. Second level is that when you have like a, your heart start pounding sometimes, when you feel like a very lonely, when you feel you have to go to the social gatherings, you have social anxiety. If you have to speak with someone, you have that anxiety. These type of anxiety you need to address with that. You should go to see your psychologist, talk with your friend. If it's not helping you, then you have to go to the psychologist. But if your anxiety is very high, like you have anxiety attacks, panic attacks, at that time what you have to do it. Some people, they have it. All of a sudden they are doing something, in the middle of that they feel like their heart start like sinking. Their heart start like, oh my God, oh my God, something is going to happen. At that time, this is anxiety disorders. There are so many types of anxiety disorders: GAD, general anxiety disorders. Then there's a social anxiety. There's like so many other types of anxieties. At that time, you have to go to see the psychiatrist and the psychologist. They both have to work together. For time being, if anxiety is having created so much hurdle in your normal life, at that time you have to take a medication for a little while, and after that you need to have take the counseling. You should know that thermometer, if it will go here, you need to address this problem as soon as possible. Because of the anxiety, your body is creating so much cortisol, and you are going there and there and there. You cannot perform as a parent, you cannot perform as a manager, you cannot perform as a leader, you cannot perform your best abilities if you have anxiety level 3 more than that. You should understand that and take a proper help. Okay, what is the stress is? We call, what do you think? Anybody can read for me? A feeling of emotional or physical tension, I will read for you. From any thought or experience resulting in frustration, anger, and nervousness, that's anxiety, body's reaction to the challenge and demands. I have to do like a 10 things today, but I can't because of my anxiety. And research shows most of the kids, if they have anxiety, their score is less than like a 10%, at least. More than 10%, it can be, with some kids, it can be 70%. But 10% is a minimum. That if the kids have anxiety, they will not, their body will react, and then they will have a problem. If any woman or if any man, if they are working somewhere, they cannot give their potential. If they have their body reaction and challenges and demands, they cannot deal with that. Next. Okay, on your body, I am going to talk about these 3 things. When you have anxiety, it affects on your body. You will have headaches, muscle pains, chest pain, fatigue. Definitely your stomach is upset, your sex is upset, everything is upset because you have anxiety. And you cannot perform what you need to perform. You have like some people, they came to me. One of my patients, she came, and every time she is going to see her doctor, she is going to see her like psychiatrist, and sometimes she goes to see like a cardiologist because she feels I have a chest pain, I have a heartache, I have this problem. That was only because of the anxiety. Her normal work was because when she's driving, she's feeling anxiety. When she's like going back to her home, she has like anxiety attacks sometimes, which is creating a lot of problems for her, and it's affecting your body. If you have so much headaches, if you have a chest pain, if you have fatigue, if you have that stomach is upset, you want to go to bathroom so many times, Other than the medical reason, this can be like a lot of time. This is like psychological reasons too. Secondly, on your mood, you have anxiety, restlessness, lack of motivation. You don't want work. If you have anxiety, you feel like just sitting in the bed and not don't do anything, and you have like a anxiety of speaking in front of other people. You will not do it because of that anxiety. Irritability or anger, sadness or depression. Sadness in the depression is the highest form of anxiety. When anxiety stays a little longer time, it becomes like a depression. Depression is affecting your body very badly. Your blood pressure is high, your diabetes is high. Even there's a lot of cancer patients. There's a study which is telling that cancer patients they have more irritation in their problem in their thing if they are having the anxiety. On your behavior, overreacting, underreacting, angry outbursts, drug or alcohol misuse. You know that a lot of kids, because when they have that problem of anxiety, they start like using their drugs and they feel like that, oh, I am also working in New Hope Foundation that's dealing with the drugs, and they are telling me all that they're telling me, like, oh, because I cannot speak, I have a social anxiety. That's why I started. I was trying to fit in with the people, with my other kid. I had anxiety. When I started taking like marijuana, I started drinking alcohol. I felt better, but they are feeling better for a little time. In the longer time, these medications, these things are not going to affect it. What happened at that time? For a moment, these drugs will just calm down you. You cannot think, you are not in your senses. But when you are coming out of that, again you have that anxiety. It's not a solution for that. Same thing for the sadness, for the depression. If you are with antipsychotic medication, for a little while it's okay, but for the longer time, they are not settling your problems because problems are still there. Then you will get out of this medication, what will happen with you? You are again, because problem is here, problem is sitting here. It's with me all the time. I'm not like a feeling well. I'm just taking medication and sleeping. When I wake up, same thing happens with me. That's very important for us when we are going to see the psychiatrist, we have to see the psychologist. Because psychologists, we are changing the life, changing the lifestyle, changing the real cause. If you have a tuberculosis, right? Everybody knows the tuberculosis. And because of the tuberculosis, you have a fever. For example, take a COVID example. If you have a COVID, because of the COVID, you have a cough, you have a fever. We are treating cough and the fever with the syrup, and the fever with like a paracetamol, any type of the Tylenol, these type of medication. But we are not using the antibiotic. The problem is the tuberculosis. The problem is becoming more and more and more and more. In the same way, the problem is our anxiety, problem is our depression, problem is like the circumstances. We should face those problems. We should rejuvenate our things. We have to grow. If we will not grow, the problems are there. You cannot run away from the problem. You have to sit and address it and talk to your psychologist. Please talk to your psychologist. Don't feel shame. Don't feel like that. You don't need it. And it's okay because yesterday I was feeling very stressed. Sometimes patient they call me and they right away they want to talk to me. And if they will come after the week, they will say, "Oh, I'm okay with that," because that was the moment. At that moment, it affected your body very badly. If you know how to the coping mechanisms, you know how to deal with the stress, how you deal with other people, then it's easy for you to understand that. But you never learned it because you just escaped from the situation. Different type of hobbies you did that, and it's bad for you. Okay, how to cope with the stress? Number one, distraction is also here. Go with that. Take this one, your coping style. Everybody has a different coping style. You have to fill this form for yourself. I'm not going to read this, I'm just going to do this one. Right? Number one, when you are feeling anxiety, when you are depressed, what the first you have to do? At home, you just get panic attack. What you will do? Ground yourself. We do the grounding techniques. We teach our like patients how to do the grounding. Grounding means like use your five senses. Allah gave you five senses. Like see five green things in your room. Then go with the four. Just try to touch four things. Oh, I have this light, I have this water, I have this blue color, I have this, four things. Then go with the three things. You can smell it. Two things you can listen the murmuring, the voice, something like that. And number one is that you can feel connection with something bigger, connection with your God. If you will tell yourself at that time when Talk and talk. Talk means that you need to talk with your friends who is like a really, really good friend. It's not a friend who loves you, but who is not intelligent, who doesn't know the religion, who doesn't know that what the psychology says, who will take you more in that direction. Do not talk with that friend because that's a disaster for you. You need to talk with the right person, right time. And whenever other person it makes sense to you, just keep it with yourself. Don't make like that. It was a timely thing. It will be over because it will come back. The other person is teaching you how to cope with those situations. Number third, self-care. That's a very important when you are talking about the boundaries. That's very important to understand that. Boundaries, other person doesn't want to keep the boundaries. At that time, tell the other person with low tone. The basic theme of my all talk is talk with a low tone. If you will talk with someone, like that, the other person, if he wants to listen, she will not listen at all. You know what other person wants, what the other person's weakness. Weakness is not in a wrong sense. I'm talking like I like somebody talk with a love. If I'm upset, somebody will just accept mistake and talk to me, and I will listen. But if you will start like blaming me, if you will start like if I'm wrong, I'm talking if I'm wrong, and if you will start talking to me, blaming me, and telling me and attacking me, I'm not going to listen to you at all. No matter what is my problem, no matter I made a mistake, but I am not going to listen to you. Yes, if you will come and talk to me nicely and acknowledge my feelings of frustration, my feeling of like selflessness, my feeling of like my own issues, my own problem, you will acknowledge me, then definitely I will listen. What is the Islamic way of dealing with that? Remember when Jafar Tayyar, he went to that presenting the Islam, and when he talked, they talk about whatever the common thing between them. They were talking about that. And you need to understand the other person and feel the other person, and then whatever you want to talk with them. And they will listen. First day they will not listen, second day they will not. But try to create that atmosphere where you can create the boundaries. First of all, you need to create your boundaries like how? Number one, you should know what you want. Unfortunately, most of the time we don't know what we want. We should know what we want. 95% patients, when they are coming to me, they don't know what they want. First of all, we have to sit and I have to tell them what they want. 95%, not like a 1 2%. The huge population, which they don't understand what they want, where they want to create the boundaries. Unfortunately, oh, she's coming to my room. She's not giving me a time. Oh my God, I don't have a time. I have to give to my family. My friends are not understanding. You don't want that. You want a friend. You want to talk with them, but you want that you talk about the positive thing. If they are talking about some religion, I love it. If they are talking about some movie, I love it. If they are talking about a music, I love it. I should know what I don't like in you and what I like in you and what I want to do with that. If I am clear in myself, if I know that what I need to do with another person, then it will be easy. Write it, what you want, and take a little good plenty of time to think what you really want in your life. Don't go here and there, back and forth, bounce yourself. Because if you are not sitting and thinking about yourself, then stress is coming more and more and more on you. And you cannot have escape. You cannot run from the situation because we are, if I will close this door, it's the same way in your life. That door is closed. You have to deal, and then you can talk to outside. You have to deal with your parents, you have to deal with your in-laws, you have to deal with your husband, you have to deal with your kids. You should know what you want. If you are clear with yourself, you can clearly explain to me what I want. That's very important for you to know. And then the first thing is the second, your thoughts. If you are a negative person or positive person, you should know about yourself. I am a positive person, I am a negative. Most of the time we think we are positive. The other person is negative. That's natural. Because we are very like a self-embedded people. As a human being, it's very difficult for us to see the other person, but there's a huge difference between human being and shaitan. What he said, he gives the excuses. Number one, number two, number three. This is my life. I am standing here because of him, because of him, because of him, because of him. This happened because we are not accepting. But a human being, as an Adam alayhi Islam, he accepted his mistake. We need to accept it. What we want, second, we should accept it. What the negativity or the positivity we have it. Very clearly. And we should get out of the distraction. That's very important. Some psychologists say there's some research on that we should be distracted. But mostly 98% research is on that we should not be distracted. We should be like go through and grow in ourselves. We should go through with the situation. We should not run away from the situation. We should like really heal ourselves. If any bad thing is happening, if any bad feeling is coming in your life, what you have to do? You have to embrace with that. Feel what is the good part of that. Anything happens in your life, it's not if Allah wants it will never happen, right? If anything happens, what the good thing you can get out of that? At least you understand this, at least you understand this, and at least you understand this. I like when Hazrat Sayyidina Ali Azizullah Ta'ala, he said that I never ever be trusting on the people because if I will trust someone and other person cheated on me, I will get a good lesson and or I will get a good friend. Definitely all the time, I don't want it you guys stop trusting, but you should know your boundaries. Clearing yourself, then clear other person. Stay positive. It's a very easy to tell you stay positive. It's the most difficult thing to stay positive. If somebody I'm texting, if somebody is not responding, I say, oh, genius is very rude. Oh my god, he's because of me. We make up the story and we start acting on that. It's not the other people. It's us who are creating the story. It's us who is creating the cortisol in our body. It's us who is like creating so many problems for ourselves. That's the more important thing in our life is us. If we cannot create the boundaries, it's not because of you, it's because of me.
I have a question.
Yes.
Difference between negative thinking and vigilance. How can you differentiate between the two?
No, that's a very good question. Because in Hadith says that a moment, a true believer can never be a person who is cheated second time from a same person. That's like we call it vigilant. Vigilant means like you are dealing with some person, and at that moment you will understand that that person is taking advantage of you, and people is cheated on you. If you are giving a one-time opportunity to other person to heal themselves, it's okay. But second time you should be like say, oh, he can do that. I should be that best with the other person, but I should not trust in that. Give him a chance to play in the playground, but don't trust unless he will be better trusted. Trust me, not that trusting what you are taking. Trust me, like give him the chance. If he's growing, if he's taking help, you are feeling like it's change is coming. If some kids are, they say, oh, I will not do it second time. They will do right there at that moment. They say, oh, just go out, I will do the same thing. Not, don't go with that. At that time, you don't have to trust. But sometimes if some person just make a mistake, by chance mistake, I'm okay if you will make a mistake with me. I'm okay if you will do something. But if you cheated on me, if you like backstabbing on me, then I'm so sorry. Then I'm not your friend. I am your well-wisher. I will do good for you because I don't want it. My body should create like a negativity in myself, cortisol in myself. But I am not expecting that you are there because I know you were not there. This is your problem. Unless you start taking help from the psychologist, you are taking start medication, you are starting changing your personality entirely different, which is like close to impossible. That's why at that time we should be vigilant. Nobody other should be like take advantage of us, but all the time we should be positive. We should help the other person if the other person needs us at the time we need. I think I answered your question. Okay. And the next thing is that is also that your values. Never ever go out of your values. Please. If you start changing your values for any other person, the long time you cannot go with that. Long time you can because you are raised in that value. Some person say, I want to leave my family. Some of my mates said, I don't want to stay with my family. I don't like them. I hate them. I said, okay, you can leave, but you can stay because the world is different. You are raised, your body, your mind is conditioned in that way as you have to go to your home. If I will come to your home, it's difficult for me. I have to see GPS system so many times. But if you are going, you know where to go because your brain is trained. In the same way, if like years ago I start driving, at that time I have to pay attention. I have to see what is happening. Oh, something is coming. But right now it's not good thing to text and drive. But sometimes I text and driving because my brain is trained. My brain is trained. Same thing we can train ourselves for the other things, positivity, positivity, positivity. And whatever our values are, not other people let invade your values. I have a value I want to be like take care of myself all my life. But because of you, because I like you, I am going to change. Okay, let's drink one day because it's okay, because you're my friend and I am going to fit in with you, because if I'm not doing it, you will not love me, you will not like me. I don't like to do this because this is my value. I don't want to have like a sex, but I will do it because other person, to keep him happy, I will do it. At that moment, I don't mind. Yes, in that moment, I will be okay, but because of him, I am leaving my values. If I'm leaving my values, I will be never be contented because that's my values. Entire life I spent like this. All of a sudden, if this light, the bottle is full, if I change it from here, what will happen with me? My body starts shifting. My body starts like not accepting those things because from my heart, I have my values. I love my values. I want to stay with those values. I cannot go in the way as other people are doing because that's their values. That's why we should be very clear about our values, because we have to know how to go through with the coping mechanism for our stress. And this is a huge thing in our stress when we are going out of our values. We should know very clearly about that. Okay, next is how to compose yourself. Go with that. Any question regarding coping styles? I'm trying to explain, like at least you guys, when you go to home, you know what you have to do with that. If you have questions, you have an email, you can ask. There's a text messaging services, you can text and you will get the response of that text. There's a phone number on that. But it's not for a call, it's not for like the talk, it's only for the text. Okay. Now we are going to talk about the most important thing, which is like a major cause and major effect of those all these problems what we discussed, parenting, medical issues, and the stress. That we need to compose ourselves. At the time of like a problem, at the time of stress, at the time of anything happening in life, we just like fall apart. We should compose ourselves because we have a remote control in our hand. We should control ourselves. If we are not controlling ourselves, no the external factors, foreign particles cannot help you. You are your own nucleus who is going to help yourself. Number one, you have to see these things. Please don't feel like that. If you are giving time for yourself, you are wasting that time. Not at all. Because if you are okay, then your family will be okay, your business will be okay, your everything will be okay. For yourself, you need to compose. You should know at the time of distress how to react. Give the messages to your brain, give the messages to yourself at the time how you have to compose yourself and how to react. Respond, react, you should know very clearly. Situation comes, you need to respond. Then, if you will react, definitely your body is going to affect it. Number one is your hobbies. Painting, drawing, and knitting. It seems like a little small thing, but trust me, whenever I have like something going on in my mind, I have to take a bigger exam, I am in a situation, I start painting. I did never know that I liked it. I never ever knew that. But right now in the COVID, I understood that I really like it. When I'm painting, when I'm doing that, I felt like in my brain things are going in a different direction. I used to watch some stupid dramas sometimes because my husband asked me, "What are you watching?" What he said, I don't know, because I was just cleaning my mind at that time. All the stuff is going out from my mind. It's not distraction. It's not distractions at all. It's like I just giving a little break from that situations. And painting is excellent, drawing is excellent, knitting. Some people like to knit. I like to do that because it helps me. If you have a gardening, go outside, do something, and don't feel like it's a wastage of time again. If your kids need you, if your husband needs you, give them a break. Take off like a 1 hour every single day for you. It's not included that you are going office. It's not included that you are eating food. It's not included that you are going to bathroom. It's not included all these things. Where you and you and you. There's a circle. There's only you, me, and me and me. Only Saima is there. What I have to do, if I will change my clothes, if I will change my dress, if I will wear my lipstick that I like it for myself. In my, this is like my plan too. Let me share with you. This is not only like I am telling you. This is I'm applying with myself and my patients, and it gives a lot of production. It's give me a lot of benefit. It's give me a lot of productivity in a different patients. I like to get ready. When I'm praying, if I'm going to masjid, some people they say, oh, you should not go, you should not wear the lipstick, you should not wear this. Definitely they should not. I'm not talking about that, what the fiqh is saying, but I am getting ready for myself because I'm going to meet Allah subhanahu wa ta'ala. If I have to pray the Fajr, trust me, my kids know that I will be ready at that time. If I'm Isha, I will be with the lipstick sometimes, with the perfume, because I'm going to see Allah subhanahu wa ta'ala at that time. This is for myself. I take like a 5 to 6 minutes, pretty good 5 6 minutes at the Fajr time, and the same at the Isha time. I love to use to go to the masjid, and thank you ICPC, they have like in Clifton, and it makes my life so beautiful after that when I started going in the masjid at the Fajr time. It's difficult. I'm just telling you because I felt it. I could not do for a long time, but I needed to be. Then I transferred it to my home. A lot of my patients, let me give you a story of one of my patients. She was so distressed, she was very low, she has so many issues, she has like a kids issues, she has like extra marital issues, she has like a relationship with someone, she was very upset. This is like 2 years back. She is like disaster all everywhere. When she started doing these things, she said, Doctor, I know that. I read it so many times, and she just threw that paper. She was very upset with me, and she threw this paper like this. And I say, okay, because I know she was upset, and being a psychologist, I understand her. And I understood at that time. I say, okay, let's talk. Then we have like a therapeutic relationship. She started trusting on me, and then we start working on these things. Trust me, today she is very composed, and she finished her education. She finished so much things, and she's more productive, like 10 times more as she used to. The first thing I said, get ready for yourself. Wear the clothes, make the hair. Sometimes I just like to cut my hair. If you will come to my home, you will see I'm all the time ready because I am doing for me and for my Allah subhanahu wa ta'ala, nobody else. Because one day you like, I'm wearing this jilbab and you like it. And you say, oh yeah, it's very pretty. Next day I'm wearing the other thing. You say, because you don't like it. If I will give my remote control in your hands, second day you will not like it and I will feel very bad. But whenever I see the mirror, I say, Alhamdulillah, Allah gives me so much beauty. Allah gives me so many things I can do for myself. Second thing, whenever I have to take coffee, I make it very special for myself.